Ever wondered what exactly happens during a stroke? Let's break it down. A stroke is a serious life-threatening medical condition that happens when the blood supply to part of the brain is cut off. Think of it as a brain attack, similar to a heart attack, but it strikes the brain instead. There are primarily two types of strokes: ischemic and hemorrhagic. Ischemic strokes make up about 85% of all strokes and occur when an artery to the brain becomes blocked, often from a clot. This blockage prevents blood and oxygen from reaching that section of the brain, causing cells to die off. On the other hand, hemorrhagic strokes are less common but often more deadly. These occur when a blood vessel in the brain ruptures or breaks, leaking blood into the surrounding brain tissue. The blood accumulates and compresses the surrounding brain tissue, leading to cell death. Now, let's talk about the physiological processes that occur during a stroke. When a stroke hits, time is brain. Every minute a stroke is left untreated, nearly 2 million brain cells die. This rapid loss of cells can affect abilities controlled by that area of the brain, such as muscle control or memory. The brain is an incredibly complex organ, with each area responsible for a different function. When a stroke occurs and blood flow to an area is cut off, the functions controlled by that area are affected. For instance, if a stroke occurs in the area of your brain that controls speech, you might have trouble talking or understanding speech. So, strokes are serious business. They can lead to long-term damage, disability, or even death. But the more we understand about them, the better equipped we are to prevent, recognize, and treat them. Now that we have a basic understanding of what a stroke is, let's delve into how we can identify one. Imagine you could save a life by knowing the signs of a stroke. It's possible. When it comes to stroke symptoms, timing is everything. Acting quickly can make a world of difference. But in order to act, we must first recognize these symptoms. Let's break down what we're looking for using an easy acronym: FAST. F is for face drooping. If one side of the person's face is drooping or numb, it could be a sign of a stroke. You might notice an uneven smile or an eye that's lower than the other. A stands for arm weakness. The person might have a sudden loss of strength or numbness in one arm. They could be unable to lift both arms and keep them there because of weakness or numbness in one arm. S is for speech difficulty. Their speech may be slurred or strange. They might not be able to understand what you're saying. They might not be able to correctly repeat a simple phrase. T is for time to call emergency services. If you observe any of these signs, don't hesitate. Call for help immediately. Every minute counts when it comes to stroke treatment. But these are not the only symptoms of a stroke. Some people experience a sudden and severe headache, dizziness, loss of balance, or an unexplained bout of confusion. Others might have trouble seeing in one or both eyes or experience a sudden numbness, particularly on one side of the body. It's important to note that these symptoms can occur individually or all at once. They can be mild or severe. They can last a few minutes or continue for hours. The key is that they are sudden. Strokes don't send a calendar invite. They often come without warning. But if we're vigilant, if we know what to look for, we can act fast. Recognizing these symptoms could make the difference between life and death, but wouldn't it be better if we could prevent a stroke from happening in the first place? Prevention, they say, is better than cure. This adage couldn't be truer when it comes to strokes. Now let's delve into the risk factors that can increase your chances of experiencing a stroke. Firstly, high blood pressure is a leading culprit. It's like a silent enemy, often going unnoticed until it's too late. Regular checkups and maintaining a balanced diet can help keep your blood pressure in check. Next on the list is smoking. It's not a surprise, is it? Smoking can double your risk of stroke. The chemicals in tobacco damage your blood vessels, leading to clots and ultimately a stroke. If you're a smoker, quitting might be the single most effective step you can take towards stroke prevention. Obesity, another major risk factor, can lead to a host of health issues, including strokes. Regular exercise and maintaining a healthy weight can significantly reduce your risk. Aim for at least 30 minutes of moderate exercise most days of the week. Now let's talk about diet. A diet high in saturated fats, trans fats, and cholesterol can raise your blood cholesterol levels. High cholesterol can lead to atherosclerosis, a condition that narrows the arteries and makes them prone to clotting. So, opt for a diet rich in fruits, vegetables, lean proteins, and whole grains to keep your cholesterol levels in check. Diabetes is another condition that increases your stroke risk. High blood sugar damages blood vessels and makes clots more likely. If you have diabetes, managing your blood sugar levels is crucial for stroke prevention. Alcohol, when consumed in moderation, might not pose a significant risk. However, heavy drinking increases blood pressure and the likelihood of clots. Limiting alcohol intake can go a long way in preventing strokes. Lastly, certain medical conditions like heart disease, atrial fibrillation, and carotid artery disease can increase your risk of stroke. Regular medical checkups can help in early detection and management of these conditions. While prevention is key, it's also crucial to know what to do if a stroke does occur. But more on that in our next segment. Remember, your health is in your hands. Make the right lifestyle choices today for a healthier tomorrow. Time is brain, a saying in the medical field that emphasizes the urgency of treating strokes. This adage underlines the importance of swift action when it comes to stroke treatment. Every minute counts, and every minute lost means more brain cells might be at risk. Let's delve into the immediate treatments for strokes. The primary goal here is to restore blood flow to the brain as quickly as possible. In cases of ischemic stroke, where a clot obstructs the blood flow, clot-busting drugs or thrombolytics are often the first line of treatment. These drugs work by dissolving the clot and restoring blood flow. However, they need to be administered within a few hours of the onset of symptoms. The sooner, the better. In some cases, doctors might opt for a procedure called a thrombectomy. It's a minimally invasive surgery where a catheter is threaded through an artery in the groin up to the blocked artery in the brain. A device at the end of the catheter then either removes the clot or delivers medication directly to the area. For hemorrhagic strokes caused by a ruptured blood vessel, surgery might be necessary to stop the bleeding and reduce the pressure on the brain. This could involve clipping the base of an aneurysm or filling it with coils to prevent it from bursting again. Swift medical intervention is crucial in stroke treatment. But remember, medical professionals can only intervene if they are aware of the situation. That's why recognizing the signs and symptoms of a stroke and calling for help immediately is so essential. It's noteworthy to mention that treatment doesn't stop once the immediate danger is past. In fact, the journey of stroke recovery is just as crucial, if not more so, than the initial treatment. Rehabilitation plays a key role in helping stroke survivors regain their independence and improve their quality of life. Treatment doesn't end in the hospital, though. Let's see what recovery from a stroke looks like. Scene script. Surviving a stroke is only the first step. What comes next? The journey to recovery after a stroke is a process that requires patience, resilience, and a whole lot of support. This process, known as stroke rehabilitation, is tailored to the needs of each individual, addressing the specific challenges they face in their recovery. Firstly, there's physical therapy. After a stroke, some people may experience difficulty with movement and balance. Physical therapy focuses on helping individuals regain strength and coordination. Therapists work with patients to improve motor skills, helping them to regain their independence. Speech therapy is another crucial part of stroke rehabilitation. Strokes can affect one's ability to speak and understand language. Speech therapists assist stroke survivors in relearning these skills. They also help with swallowing problems that can arise after a stroke. But stroke rehabilitation isn't solely about physical recovery. Emotional support plays an equally essential role. Strokes can be a traumatic experience leading to feelings of frustration, anxiety, and depression. Support from psychologists, social workers, and support groups can provide a safe space for stroke survivors to express their feelings and learn coping strategies. Beyond these therapies, the environment in which a stroke survivor recovers is of utmost importance. A supportive and understanding environment can make a world of difference. This includes not only the medical team but also family and friends. They can provide practical help, like assistance with daily tasks, and emotional support, offering encouragement and companionship. It's important to remember that recovery timelines vary. Patience is key. Each small improvement is a step towards recovery, and celebrating these milestones can provide motivation to keep going. In conclusion, life after a stroke may indeed be challenging, but with the right care, support, and attitude, living a fulfilling life is entirely possible. Every stroke survivor's journey is unique, but one thing remains constant. Recovery is never out of reach. Life after a stroke may be challenging, but with the right care and attitude, recovery is possible.